Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Global Deterioration Scale assesses the severity and progression of cognitive decline in individuals with primary neurodegenerative conditions such as Alzheimer's disease. It categorizes cognitive impairment into 7 distinct stages, ranging from no cognitive decline to very severe cognitive decline. The main purpose of the scale is to provide clinicians with a standardized framework to evaluate the clinical course of dementia. This tool aids in treatment planning, communication among healthcare professionals, and monitoring disease progression over time. It focuses on memory, cognitive function, and activities of daily living to determine the extent of functional impairment. The Global Deterioration Scale is indicated for patients with primary neurodegenerative conditions causing cognitive decline, particularly Alzheimer's disease and other dementias. It is most useful in clinical settings that require staging of dementia severity to guide treatment decisions and care planning. The scale facilitates the assessment of progressive cognitive and functional deterioration from no cognitive decline to very severe impairment. It supports clinicians in monitoring disease progression and evaluating the effectiveness of therapeutic interventions over time. The scale is widely employed in memory clinics, geriatric care, and research focused on dementia progression. The Global Deterioration Scale consists of 7 stages that assess cognitive decline primarily related to dementia. The clinician begins by conducting a structured interview composed of multiple items, evaluating memory, orientation, judgment, and daily functioning. The tool includes approximately 30 questions designed to capture gradual cognitive changes over time. Response formats vary between objective observations and patient or caregiver reports, typically using categorical scales reflecting frequency or severity. Each stage corresponds to a distinct clinical profile, ranging from no cognitive decline at stage 1 to very severe cognitive decline at stage 7. Stage 1 indicates normal cognitive function. Stages 2 and 3 signify mild cognitive impairment and early dementia, respectively. Stages 4 and 5 describe moderate cognitive decline with increasing dependence. Stages 6 and 7 reflect severe cognitive impairment with loss of verbal abilities and basic motor skills. Interpretation requires correlating patient responses to criteria outlined in the scale's reference values to assign the appropriate stage, guiding diagnosis and care planning. The Global Deterioration Scale demonstrates variable sensitivity and specificity depending on the stage of cognitive decline being assessed. Sensitivity refers to the ability of the scale to correctly identify individuals with dementia, while specificity denotes its ability to correctly exclude those without the condition. Studies report sensitivity values ranging from 0.75 to 0.95 for detecting moderate to severe dementia, indicating a high likelihood of correctly identifying affected patients. Specificity values are generally reported between 0.60 and 0.85, reflecting moderate accuracy in excluding non-demented individuals. For example, in a clinical setting, a sensitivity of 0.9 implies that 90% of patients with dementia are correctly identified by the scale. Conversely, a specificity of 0.7 indicates that 30% of cognitively normal individuals could be misclassified as impaired. These metrics underscore the importance of using the Global Deterioration Scale alongside other diagnostic tools to enhance clinical decision-making. The Global Deterioration Scale was developed in the early 1980s by Barry Reisberg and colleagues as a clinical tool to assess the progression of cognitive decline associated with Alzheimer's disease and other dementias. Validation studies have demonstrated strong correlations between the scale's stages and objective cognitive measures, neuropsychological test performance, and functional assessments. For instance, research has shown that individuals classified at higher stages of the scale exhibit markedly greater impairments in memory, language, and activities of daily living when compared to those at lower stages. Longitudinal studies have further reinforced the scale's ability to track disease progression over time, with reported inter-rater reliability coefficients ranging from 0.8 to 0.92 in various clinical settings. Imaging studies have supported concurrent validity by revealing that advancing scores correspond with increased cerebral atrophy and metabolic changes identified through magnetic resonance imaging and positron emission tomography scans. Collectively, these data underscore the scale's utility as a clinically relevant and scientifically supported measure of cognitive and functional deterioration in dementia-related conditions. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.